In this video, we'll be discussing 5 danger signs of your period. If you're seeing this face for the first time, welcome. My name is Ifechukwu Prudenciana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. I film health-related content, especially family planning and reproductive health. If this is the kind of content that you're interested in, keep watching. And please don't forget to hit the follow button, subscribe to my YouTube channel, and please share my video. 5 danger signs of your periods that you should not ignore. Number 1 is cycle length below 21 days. Normally, the average cycle length is 21 days to 35 days. So whenever your period is below 21 days, is a problem, is a danger sign. Please don't ignore it. Some people menstruate like almost every 2 weeks. They will be seeing their period. This is a danger sign. And usually they will be having irregular menstrual cycle because when a cycle is coming every 2 weeks, automatically you cannot be able to calculate your ovulation, your fertile period, your safe period, and your unsafe period. It will be very difficult. And this can be as a result of stress, sexually transmitted infections like gonorrhea, chlamydia, and it can also be as a result of perimenopause. Perimenopause is like the first stage of menopause. When a woman is approaching menopause, her cycle starts to be irregular. She will start noticing some changes in her menstrual cycle. But you cannot be able to say it's perimenopause because some people, it doesn't start early. Some people, it starts early. But you don't need to diagnose yourself. You still need to go to the hospital and see your doctor. It may be infection that is causing it. So you need to treat yourself. If it is as a result of maybe stress, please reduce the rest as which you expose yourself to stress. It's a danger sign, meaning that something is wrong somewhere. Please don't ignore the sign. Menstrual cycle is supposed to be from 21 days to 35 days. Any cycle below 21 days that is consistent, please see your doctor. And to some few, it's normal. You can only say it's normal when you must have done some investigation and your doctor tells you that, oh, this is normal for you. When there is no problem with your reproductive system, when there is no problem with your health, all your body organs, everything are intact, then the doctor can be able to tell you whether it's normal for you or not. The next sign that you don't need to ignore is a cycle that is above 35 days. When a cycle is above 35 days, that means the cycle is irregular, it can be prolonged, it can be heavy, a lot of things can be the cause. Example is polycystic ovarian syndrome. People with polycystic ovarian syndrome usually menstruate for 4 to 6 times in a year, and that's it. Most of their periods are anovulatory, meaning that they don't even ovulate. And when the period finally comes, it comes with heavy bleeding. So they usually have prolonged menstrual cycle. And you cannot just diagnose yourself of PCOS only because of prolonged cycle. We have 3 signs that when you see when you see 2 in the 3, or when you see 2 out of the 3, or when you see the 3 of them, you will not know that this person most likely is having PCOS. So you need to see your doctor. Don't ignore it. A cycle is supposed to fall within 21 days to 35 days. So any cycle that falls above 35 days or below 21 days, there is a problem, except otherwise proven by medical practitioner and experts. Please see your doctor. Always look after yourself. Please. Another sign rather that you should not ignore is active bleeding. Normally, menses last for about 2 to 7 days. When you have an active bleeding beyond 7 days, there is problem somewhere. When I mean active bleeding is that when menses starts, it's usually very light and scanty. And then it progresses to second day, third day, and it starts being heavy. Once it's about to end, it should still be light and scanty. But in these people now, the bleeding is still very active and heavy for more than 7 days. Sometimes it can be a sign of miscarriage, PCOS, fibroid, or any other gynecological issues. So if you don't know exactly what is wrong with you, you need to see your doctor so that you get yourself evaluated. Probably they will do an ultrasound to see what is going on inside your reproductive system. Then another sign that you are not supposed to ignore is extreme dysmenorrhea. Normally, when a woman is menstruating, she will feel some pain, cramps, discomfort. But when the pain and the discomforts are extreme, it comes with vomiting, fever, abdominal pain, cramp, dizziness, and heavy bleeding. There is a danger somewhere. Either from the reproductive system, something is wrong somewhere. It's either there is polycystic ovarian syndrome, endometriosis, or any other gynecological disorder. So this person needs to see the doctor. So you'll be given an accurate diagnosis of what is wrong with you. It is a danger sign for you to have extreme dysmenorrhea. It is normal to have pain, cramp, but once the dysmenorrhea doesn't go with paracetamol or ibuprofen or the normal one people take like aspirin, something is wrong somewhere. You need to go see your doctor and get yourself evaluated. The last but not the least is in-between bleed. This is usually occur in women that are on hormonal birth control. They normally bleed like intermittently. Sometimes they will bleed for a day and it will stop. The next week it will start again. For 2 days it will stop. Next 3 weeks or next 2 weeks it will start again, just like that. And some of them don't even see their period at all. Once they start the birth control method, they don't see their period at all. Some of them, their period will be prolonged, and some of them will be experiencing heavy flow. So whichever, please see your doctor so that things will be corrected. If there is any mistake somewhere, or if there is anything that needs to be corrected, it will be corrected on time. Do not assume and presume that, oh, it is normal because I'm on pills, because I'm on Implanon, because I have Jadel, this and that. No, do not assume. Please, always seek for medical advice from your doctor to be sure of what you are doing and what is wrong with you. I hope this helps. Please like, share, and comment. Until I see you again in my next video, do take care of yourself and drink plenty of water.